Hello. Thanks for being here with us today. Welcome back to our day 19 of our Contigo Wellness 30-day challenge, where we're challenging you to learn more about mental health and implement some of the wellness strategies that have been presented. We're also really excited to highlight the work that our amazing Hispanic and Latinx therapists are doing out in their communities. We've had some really wonderful workshops so far on mental wellness, and we hope that you have enjoyed them as much as we have. Today, we have a special guest, Orietta Coz, who's a clinical psychologist licensed in Florida. She has a private practice called Seeds of Hope Behavioral Health, where she specializes in maternal mental health. She became very involved with maternal mental health soon after she gave birth to her son, and then became very passionate about being part of a mother's journey. She was born in Peru and immigrated with her parents to Canada. She left Canada for graduate school in the USA and has been here ever since. She graduated with a doctorate in clinical psychology with a specialization in children and adolescents from Adler University in Chicago, and was lucky enough to be placed in a children's hospital in Miami, Florida, to complete her training. Since then, she's worked in multiple environments throughout her studies and thereafter, including community mental health, children's hospitals, behavioral health clinics, and now in her own private practice. In her brief presentation, she's going to be discussing how our expectations as birthing individuals compare to the reality and how that can impact our thoughts. She's also going to cover perinatal postpartum depression, anxiety, OCD, trauma, and psychosis, and briefly discuss neuroplasticity and specific ways in which we can manage stressors in order to decrease the power and impact that negative thoughts have in our lives. So thank you so much, Orietta, for being here. We're so happy to have you.
Hi, Diana. Thank you so much for this wonderful opportunity with Contigo Wellness. Let's get started because I'd like to share a lot of information here today. I'll be discussing psychological wellness for mothers and mothers-to-be. Just really quick note, the disclaimer here is that everything that we discussed today, everything that I discussed today will be for educational purposes. At no point does it replace therapy, treatment, or diagnosis. I will provide a reference that will be for informational purposes only. If you do need to speak to a specific therapist or anything like that, please feel free to email me and I may be able to provide you with a specific referral. Okay, thank you so much. Now, I want to talk to you a little bit about neuroplasticity. It's going to be very, very brief, just for you to have a good understanding of the fact that our brain changes based on what happens to us, no matter our age. So even us as adults, this is still going on. We're also going to talk about the expectations of motherhood and the reality that we face. Sometimes it's a slight shift. Sometimes it's a very big and jarring shift. And how the thoughts that are triggered due to those expectations and reality shifts impact how we feel and how we behave. And I'll be talking about what I call as your perception, your inner dialogue, and all that stuff. And most importantly, how do we manage this? How do we manage this inner dialogue to be more positive? How do we manage from saying negative things to ourselves, isolating, leading to the possibility of depression and anxiety or further from happening? And that's doing something about it now. Not when the kids are older, not when you have more time. No, it's what we can do now in the present. As I had mentioned to you, our brain has the ability to change. Even as adults, our brain adapts to new situations. That's what we call neuroplasticity. When we have sleep, love, tender loving care, meditation, exercise, nutrition, our perception is more positive and we reduce our stressors. That neuroplasticity changes for the positive, towards the positive. When we, for example, continuously say negative things about ourselves, then it changes for the negative. The way that neuroplasticity occurs is we repeatedly practice an activity. And what happens is, as we practice and practice and practice, our brain is making all these new connections. So every single time that we practice, it takes less energy to get the activity, to get the task done in the way that we want it to get done. And that goes along with what we were just talking about, that negative inner dialogue. The more we do it, the less energy our brain takes to kick into that negative thinking mode. And so the purpose in all of this is for us to be able to change it. Instead of it kicking into that negative thinking mode, I want it to be more positive. I want it to be healthier so we can maintain our mental health. because motherhood is all about mental health. Not only are you taking care of yourself, but you're taking care of other beings. They're very dependent on you. So let's talk about those expectations versus reality. Most of us have a lot of expectations, whether it's our first child that we're bringing home, or we've had multiples. Each one is very unique. Each experience is very unique. What we need to remember is how to manage those expectations, because reality is going to hit. So an expectation such as, I'm going to love motherhood. This is my expectation. I'm going to love it. At this point in my life, I had specialized in children and adolescents because I enjoyed working with them. So I thought, the day that I have my own, I'm going to love it. I'm going to love it. I did not. It was so difficult. It wasn't at all what I was expecting it to be. I didn't think it was going to be so hard. I didn't think my anxiety was going to shoot so high. It was lonely because I didn't hear other people talking about it. So I felt like I was alone. Not only that, but my anxieties and all the feelings that I had, shame, made me isolate myself even more. And so again, we're talking about those negative monologues that we have, that inner monologue, that script that we're starting to create for ourselves. I said to myself, this isn't what I expected. I'm not good at this. Did I make a mistake? Am I ever going to be good at this? I can't do this. And so, just like what I was saying, when those expectations are not met, we start to experience negative thoughts and emotions. When those negative thoughts and emotions lead to even more when it comes to isolating myself, I started to feel a great deal of anxiety. I started to feel sad, irritable. There's a lot of anger, a lot of shame, embarrassment, disappointment. If it goes untreated, if you don't talk about it, if you don't seek that help, it could lead to perinatal postpartum depression. It can lead to anxiety. It can lead to obsessive compulsive disorder. It can lead to possibly a re-traumatization. It can lead to you having had all these experiences and quite possibly experiencing psychosis. And nobody knows about it because you don't say anything, because the shame and all those feelings that keep you quiet are much stronger. So I want you to see what the risk factors are, so you're very well aware of it, and you can do something either to prevent it from leading to that point of crisis, or prevent it from leading to a mental illness altogether. It's also important for you to know, as part of risk factors, is if you've had a history of any type of mental health problem, if you've had a history of traumas, if there is a family history of mental illness, that can play a role in all of this too, and escalating those symptoms, or not finding the support that you need around you, because those individuals might be triggered or might be going through their own situation and not be there for you. So briefly, I just want to talk a little bit about perinatal postpartum depression and anxiety. When I'm talking about perinatal, I'm talking about any time during your pregnancy. With postpartum is after birth. And that also includes for those individuals that adopt babies and adopt little ones and bring them home. That is a postpartum period. Baby's new. You're learning. It is so important. I want you to read these over. I'm not going to read them all to you. They're right there for you. These are risk factors for you. If you start to notice that you're having these experiences, ask your support system for that reassurance, that emotional support, a little bit of help, whatever it may be that you need at that time. And if you don't know, that's okay. You say, I need some help. And it's trial and error of how they may be able to help you. Perinatal postpartum OCD, obsessive compulsive disorder. This is very important because what happens here is that you have very intrusive and repetitive thoughts about the possibilities that can happen of harming your baby. So something like, for example, I'm going to be, carrying this baby and I'm going to fall on my baby, or I'm going to drop my baby, or I'm going to burn my baby in the bathtub because the water is going to be too hot. These are all fears of harming your baby. But you know inside of your head that there's no way that you could ever do this to your baby, but you're so afraid that it might happen. So what do? You do everything possible to prevent any harm from coming to your baby, to the point that you obsess over doing certain things. You are compulsive about it, whether it's checking the temperature of the water every 30 seconds to make sure that the water temperature hasn't changed, or or you make sure that that door is locked, and you need to do it repeatedly because you don't want anyone coming into your home to harm your baby, or you don't want to get close to your baby because you have a fear that you're going to drop your baby as soon as you pick up your baby. This can lead to a mother saying to herself, I'm not good enough. My family's better off without me. And so there's an extremely high risk when a mother is experiencing these types of thoughts. There's an extremely high risk of suicide. So please, if you're having these thoughts, don't have any shame. Don't have any shame to talk about it. Don't have any shame to seek support. This is the time to do it. Before anything happens, we're here to help. With perinatal and postpartum trauma, we're talking about a perceived trauma, whether having childhood, throughout life, or birth trauma, or whether the birth triggered something in you that you didn't remember that happened, or something that you thought you had dealt with a long time ago. It's your perceived trauma. And that can really impact the way that you experience everything around you, to the point that sometimes the inner monologue takes you there. It takes you back to your trauma and you're reliving your trauma. So please, if you're having any of these experiences, make sure that you're seeking that support. With perinatal psychosis, this is an emergency. This has a very early onset. It's usually in the first 2 weeks of giving birth that you'll see a lot of these symptoms. A lot of hallucinations, whether it's hallucinations or delusions, a lot of confusion, disorientation. The risk of harm here is quite high. Unlike with OCD, where you recognized that those intrusive thoughts were not real, we're doing everything possible to prevent it. Here, you believe them. You actually believe your intrusive thought. And the likelihood goes up of you doing something harmful, either to yourself or to the child. Let me give you an example of a delusion. Seeing the devil in your child, where this woman actually thought her child was the devil. And so she feared what would happen to this child. She feared how people would embrace this child, or lack thereof, really. And so she wanted to protect this baby. And what happens? In her mind, the only way to protect this child was for him to not live. And she realized what had happened. She could not deal with it herself either. Not only that, but even while she was having these intrusive thoughts that she actually believed, she was at fault for it. She gave birth to this child. And so she didn't want to do that again. This is very difficult to talk about. It's very difficult to hear, but it's real. It happens. It doesn't happen as often as depression and anxiety, because with mood disorders and anxiety disorders, it's 1 in 7 women that experience some type of mood and anxiety disorder. With psychosis, the probability is a little bit higher. It's 1 in 1,000, but it is very high risk. And this is something that you hear every so often. People saying, yeah, she was saying weird things. Or, yeah, the mom mentioned she wasn't herself. There was something off. Please listen. See the person and listen. Listen to them, believe them, and seek that help. If they're not able to do it themselves, you can do it for them. And so what do we do with this inner dialogue? What do we do with the inner dialogue that says, I'm not good enough? They're better off without me. This is too hard. It wasn't what I was expecting. As a psychologist, what I would do here, cognitive behavioral therapy. So let me teach you a little bit about it. With cognitive behavioral therapy, it was Dr. Beck who actually created it. He did a number of studies on it and realized that our perception of a situation is what influences our emotions and our behaviors. So here you see, we have your event, which is the triggering situation, the thought, how we interpret the situation, how we perceive it, the feelings that come up due to our perception, and then the behaviors. Are they hurtful or helpful? So let me use it as an example. This is actually my example. So the situation was, I was pumping. I wasn't producing very much milk. I never produced very much milk. And for any of you that have actually pumped or breastfed or just fed, and you know how much your baby eats. You know how much I was producing. I was producing 8 ounces a day. I tried everything you could ever imagine, and still nothing. In my mind, what I was thinking, what was going through my thoughts, I don't think my baby's eating enough. I'm not producing enough milk. Am I harming his intellectual development? Is it normal for him to eat this much? Is this why he's not sleeping? What will my family say if they see me giving him formula? I can't do this. I don't know how I'm going to do this. And this was my inner monologue. Every single time I tried to pump, every single time I wanted to give my baby just a little bit of my milk in addition to the formula, because that was essentially what was feeding him. So the emotions that came out for me: guilt, frustration, sadness, anger, disappointment, embarrassment, and shame. Oh my goodness, a great deal of shame. So as a result, what did I do? I isolated myself. I became extremely irritable with the person that was with me at all times, which was my partner. I extended the amount of time that I would sit there and pump, thinking that maybe if I sat there even longer, I'd get a little bit more. Not just that, but instead of sleeping when I should have been sleeping, I was doing research. I was reading everything I could about brain development and feeding, and brain development and formula, and how I can produce more milk, and how many women does this happen to? It was just ridiculous, the amount of time I was spending on that. And so what do we do with this inner monologue that is very negative? So here, let's go through it again. The event. I was pumping and I wasn't producing enough milk, and I knew it. So my thoughts. Do you remember my thoughts? I'm not good enough. I'm not able to produce enough milk to feed him, to keep him healthy. I'm impacting his development. What is the evidence to support this? Obviously, I had my little, bottle, 8 ounces. That's my evidence to support it wasn't making enough. What was my evidence to disprove it? Nutrition. I would see him regularly and would say he's within average. He's in the average percentile. He was gaining weight. In general, he was a happy baby. He had a colic, didn't sleep very well. But in general, he was a happy baby. He interacted so well with everyone who would come to visit him. And so I needed to validate that feeling that I had, where I felt shame because I didn't produce enough. Shame because I didn't meet my expectation. Disappointing others was a big one for me, because you know what I heard all my life? Every person in my family talking about how this person breastfed and this person breastfed and this person breastfed until this kid was whatever age. I didn't fit. I didn't fit with that. But I had to acknowledge my reality. That's part of my behavior. I had to acknowledge the reality that biologically this happens. This happens to a few of us. Biologically, there was nothing I could have done because I tried, and it didn't change. So I had to change my perception and my inner dialogue. So I like to call it flip the script. I'm going to flip that script, and I'm going to change my perception. I'm not doing anything wrong. This was out of my control. I'm still able to meet all of his needs. This baby is developing just the way he should be. All of his needs are being met, no matter how much milk I produce. And most importantly, my self-worth is independent of how much milk I produce. My value as a person, as a mother, does not go up or down depending on the milk that I produce for this baby. Because again, I'm meeting all of his needs, no matter what. And so what is the evidence against this thought? I need to remind myself again, he's healthy, he's happy. Do you see how that happens? And again, it's just like what we initially started to talk about. This is a task that you need to practice in order for your brain to make the connections and make it easier and less energy being put towards it in order to accomplish it every single time. It takes time, just like motherhood. You have to learn. You have to learn how to do it. It takes practice. It takes that neuroplasticity of your brain to learn to make that connection and figure it out. It's easier and easier to do. This gets easier and easier to do. In addition to this, as part of the now, not only is it to practice those CBT skills, but also utilize your self-care. Take a look at these little affirmations. Have them around your house if you need to. Have them in your journal. Put little pictures like this that might make you chuckle next to them. I'm worthy of a child. It's okay to ask for help or emotional support. There'll be good and bad days. I must take it one day at a time. Find your village mamas. Sometimes it's not the one you pictured. or it's not inclusive of the people that society or your culture tells you should include. Rather, it's one you've intentionally created. You want to have supportive individuals in your village. You want to have those individuals who see you. You want to have those individuals that do not judge you, that do not shame you, that provide you with that TLC, that love that you need. Manage your expectations. Because, a lot of our negative thoughts come from there. Obviously, they also come from our experiences in the past, family, and what we've learned and what we've observed. But once we can really have some management or control over it, it's our own expectations and the reality. We need to remember one's an expectation, and there might be a lot of shifts towards reality. Sleep. Please, almost sleep. I don't know if you remember, but criteria for depression, anxiety, OCD, trauma, psychosis, difficulty sleeping. Difficulty sleeping escalates it. You know why? Because when we sleep, we regenerate. Our patience regenerates. Our brain regenerates. Our energy regenerates. And that love is just even more powerful when we have sleep. So it's so important for you to find someone to either help you with the baby so you can go to sleep. Because let's be honest, let's be realistic. Whenever someone says to you, sleep when the baby's sleeping, easier said than done. Nutrition, don't forget to eat. It's so easy to forget to eat because there's so much going on in front of you. There's so much going on up here. Don't forget to eat. Exercise. By exercise, I mean just move around. Go for a walk. Go for a stroll. Move around. I'm not talking about jumping jacks. I'm not talking about rigorous. Just move around. Boundaries. A lot of people think boundaries means you saying no. Boundaries actually means you telling the kids, or you telling your partner, or you telling your loved ones around you, I'm setting my timer for 5 minutes. These 5 minutes are me time. Once those 5 minutes are over, that timer is gonna make a noise, and then I can answer any questions. I can help you with whatever you need. But please remember, this is me time. Set your timer, go catch some sun, have your tea, have your coffee, whatever it is, and you enjoy your me time. That's setting a boundary. Just like anything else, that practice is going to allow your brain to change. It's going to allow their brain to change and recognize that, oh, okay, mom is having her me time. She's setting her alarm. She's setting the timer. Meditation. Meditation, there's so much research surrounding meditation and how much of a positive impact it has on neuroplasticity. And meditation does not mean having a clear mind, having to sit there in silence. It's being in the present. It's being mindful of what your body is doing. It's being mindful that your thoughts are coming and you're saying to them, not at this time, and let them go. Being mindful, being meditative in terms of you just concentrating on your breath, on your body, on your stomach, in and out. You might start to feel your heartbeat just by sitting and concentrating and thinking and being mindful. Grounding techniques. What grounding techniques means is bringing you into the present. A lot of the times when we have these inner dialogues in our minds that are negative, we are living up here, or we're living in the what if, in the future. And so we're missing out on the present. These are different ways of how to be back in the present. And a lot of them have to do with using your 5 senses. So take a look at those. I'm not going to get into them, but they're there for you. Again, it's using your 5 senses. Being mindful of those 5 senses. Concentrating on them. And lastly, seek support. Postpartum Support International has free groups for you that you can attend. I've just shown a few of them here. I have their website as well if you'd like to explore that, because they also have a ton of other resources for you. Postpartum dads, they have a specific group for dads or partners of those individuals who are the birthing parent, and your toll-free helpline in case you need to talk to someone, in case those intrusive thoughts have become too much and you feel like you don't have anyone to talk to. So thank you so much for listening. I really hope this was helpful for you. And I want you to remember that It takes time. Motherhood, it doesn't matter how many kids you have. Each one is unique, and each phase of our life is unique. And it takes time to adjust. It takes time to learn. Be patient with yourself and remind yourself what children need most is connection, not a perfect. Thank you so much. I really appreciate your time. And if you have any questions or anything like that, please just let me know. Thank you so much. Bye.
Thank you so much, Orietta. This was such an important topic. We really hope that you all enjoyed this workshop today. And we'll leave Ori's information if you want to reach out to her and learn more about the work that she's doing in her community. Join us tomorrow for Self-Care Sunday as we talk to Ariana about yoga and the importance on the mind-body connection. Thank you for being here.